Here's our patient today. She is a 62-year-old woman who, first of all, dislikes the droopiness of her neck, and you can really see it on the side view, the profile view. So we're going to do a lower facelift to lift the neck and the lower face. We're also going to improve her jowls as well. But we're also going to do a buccal fat removal. She's got a bit of a rounder face, a bit of a bottom heavier type face. So I'm going to take fat out of her buccal spaces here and here to help contour that area. And the final thing we're going to do is we're going to open up her eyes. You can see her eyes are pretty heavy. You actually can't even see her eyelids here. So I'm going to perform an upper blepharoplasty to help open up her eyes so you can see her lids afterwards. So let's take a peek at her markings in the OR.
Okay, here are her markings. Now let me just show you, she had a previous lifestyle lift many years ago. This line here is the scar from her old lifestyle lift, and you can see how it's just in front of her ear. There's no artistry to it. These are the markings that we're going to do. Those are the incisions we're going to make around the ears, and you can see how that's going to really curve around her ear. Now, it's also going to go behind the ear and down, so that's where her scars are going to be. This is just a line of her jawline. We're going to take her jowl down. We're going to take a little buccal fat out. This is the lower extent where I lift the neck. I'm going to try to defat and lift that as much as possible. And you can see this is the skin we're going to take out of her eyelids. So I'll show you how she looks once we're all done, and I'll show you the fat that we take out of her buccal space as well. We are all done. She did fantastic. You can see she's definitely a little swollen, but you can already see she's got a much nicer neckline here. She does have the little incisions. You can see where the little stitches are. Those will mainly come out all next week. Opened up her eyes, got rid of the excess skin, which you can see there as well, and I took out her buccal fat pads on both sides. Let me show you how that fat looks. These are her buccal fat pads, and I was able to remove one of them through the facelift incision because it was herniating out. The other one, unfortunately, I had to go inside the mouth. You can see it's a pretty good size on each side, so this should help to contour her face in very nicely. And I am excited to show you how she's going to look here in the near future. All right, we are 2.5 months out of her surgery, and she is healing really well. You can see, can I have you close your eyes for a sec? So you can see she has a little scars in her upper eyelids. They're still a little swollen, and that's going to get better as time goes on. Her eyes are nice and open. And I'm just going to show from the side. She's got a nice, sharper jawline. Still a little bit swollen on the left side of her face through here, but that's going to continue to contour in along with this side because of that buccal fat removal. So I'm real happy with where we're going at, how we're doing today. And she's just going to contour a bit more as time goes on. So a very nice result. So I hope you enjoyed looking at her surgery and her before and after results. Now, a few things. With a facelift, it's a very good procedure to help lift all the stuff that's sagging down here. But you got to remember that it comes with significant scarring, and that scarring extends around the ears. The scarring is permanent. It never goes away. So you always want to weigh what's the negative of the scarring to the positive of lifting the neck and defatting the neck. We also did a buccal fat removal on her, and that's where I went on the inside of the mouth to remove the fat from the cheeks. I do that quite often on people who have what we call bottom heavy faces or excessively round faces to help contour it in. A buccal fat removal should not be performed on somebody with a thin face though, because that can make the face look even thinner. Now, right now, some people on social media, they kind of like that look, that kind of Kardashianizing the thinning of the face. So people are doing more buccal lipectomies or buccal fat removals than they should. But buyer beware, because as you get older, the face normally does thin, and you don't want to over thin the face later on, because once that fat's removed, you can't necessarily put it back. Then finally, we did her upper eyelids, remove the excess skin, open them up. That is a surgery that if you've got so much extra skin that you can't see very well, your insurance may cover it for you. It didn't cover her because she wasn't bad enough, but if you've got a lot of extra skin and it's impinging on your vision, you might want to look and see whether health insurance may cover it. So I hope you found that interesting. Take a look at this video that we have right down here because some more very interesting surgeries and procedures for you.